Dislocation of the kneecap, also referred to as patella instability, is a relatively frequent injury in the young athletic population. The injury typically occurs when an athlete or active individual plants the knee and twists with the knee in a semi-extended position. As that occurs, the kneecap translates and actually shifts out of where it should be in the groove at the end of the femur and typically goes laterally. Sometimes this may need to be reduced on the field by a trainer or staff and may require emergency department reduction. Occasionally it will spontaneously reduce and move back into place on its own. Management of this problem can be non-operative or operative depending on the patient's individual scenario. Typically, when you sustain an injury, you'll be evaluated by our team with x-rays and potentially an MRI to further evaluate for both the kneecap dislocation event as well as for any sort of associated cartilage injury that may occur during the kneecap dislocation. If it appears to be amenable to non-operative care, we'll begin a course of rehab with physical therapy to get you back to where you want to be. Many times, however, especially if the dislocations become recurrent, we will need to pursue an operative intervention and proceed with surgery to stabilize the kneecap. If surgery is required, it typically involves using your own tissue or a cadaver to rebuild and reconstruct a ligament that will tether the kneecap in place and prevent it from further dislocations. This is done by creating a small trough within the patella and anchoring it there with several anchors. The tendon is then passed through the medial soft tissue to the femur, where it is fixed with a small anchor as well. We then begin rehabilitation, which may take up to 4 to 5 months for complete recovery.